My name is John Santana. I'm a crane operator. Been running cranes since 1979. Besides that, I have a little kind of farm, 5 acres. On our farm, we have cows and chickens and big backyard and fire pit, and we have a swimming pool, and the grandkids come and they'll drive the golf cart and four-wheelers, and we have a fabulous time. We always have big parties, very active around my place or my grandfather's place.
John first noticed his pain while attending a friend's wedding. Over the years, his pain continued to worsen to the point that he couldn't work or perform chores around his farm.
My pain started probably about 8 years ago. And we were actually going to a wedding in Las Vegas, and I couldn't walk down the streets. My sciatica in my left rear was hurting, and it was hard to walk around and all that. And I just been dealing with it for, many years. And then this last 2 years, it kept going worse, where I had a numbing sensation down my left leg, and extreme pain. The pain kind of went away a little bit, but it was still, my whole leg's numb. All the years of hard work has kind of destroyed some of my lower back. If I go out and I fertilize the grass, my wife has to spell me halfway through it because my calves are burning so bad and I can't walk anymore. My back does go out like 2 or 3 times every year, where I can't walk and bend over too much for like 3 weeks, and then it just kind of goes away.
John tried conservative treatments at home, but when they didn't eliminate his pain, he went to his local doctor for help.
Try to ice it, and stretching. It makes it always better when you're stretching, do the right stretches. That's why I've dealt with it for so long, 8 years. And so I had my doctor that set me up for an MRI back at home, and then that's where the diagnosis was spinal stenosis. Talked to surgeons. I went to like 2 or 3 of them and dropped it off. But in the medical industry, it's so screwed up where you have to have somebody request and do this and all this red tape, and it takes you forever to go even get an appointment, or they forget about it, or it's on somebody's desk, and it just kicks the can down the road. Because the way the system really is terrible in the medical industry. I'd hate to see it a government funded. We'd be really bad then.
John initially heard about the Bonati Spine Institute on TV. Curious, he contacted Bonati to learn more about the exclusive Bonati spine procedures.
I heard about Bonati through Newsmax. I'd watch his shows on the weekends and all that kind of stuff, where his wife's in there and they talk about it and everything else, and I thought that was a better way to go. And then I reached out. Actually, there's another gentleman that lives in Oregon that had the procedure done, and he's doing very fine now.
After speaking to Dr. Bonati on the phone, he made an appointment and booked his flight from Oregon to Hudson, Florida.
Dr. B called me, but I couldn't hear, because I was working, and I didn't know who it was and all that. And he said I had a back of an 85-year-old man and didn't know if I'd go upstairs and everything. And he did say it was pretty messed up. And so I did talk to Bonati, and I think the very, very first time. And then, Dr. Wolf was my surgeon, and he reached out to me and, before the surgery to go through the process, because I'm kind of a detailed guy. When I arrived down here, it was very, helpful, and they got me right in, and we took care of business, and everybody guided me and helped me.
The targeted Bonati spine procedures are performed incrementally and on an outpatient basis while utilizing conscious IV sedation. This allows the patient to remain awake and communicating with their surgeon to ensure the source of their pain is eliminated before they leave the operating table.
Like after the second surgery, there was less numbing going down my leg. They were communicating with me, through my final surgery, which I think probably was the roughest, because that was where most of the damage, was. Everything went really well. I was very pleased, and as soon as I got out of surgery, I was already kind of awake, to go into the waiting room there and recovery room, and then my day was done. They did have me walk and make sure I was stable, and gave me some apple juice and a cookie, because I was really hungry.
How's the pain on a scale of 0 to 10?
Good. 0.
Excellent.
Yeah, my experience so far, I feel, has been a success, because the way, they operate it and they do the business, and, I had a wonderful caregiver that's been helping me and taking me all my appointments and taking care of me and everything. It's been, a wonderful experience. Yes, I would recommend this procedure because, the process is, very sensible and smart. They recommend, walk every day and, 40 minutes a day. And my advice for somebody, if they do have a spinal stenosis, is probably check all your options. Don't go with your local doctor and all that, because usually they want to harm you and they don't really care. And then they see you back in 8 years. So I always try the least invasive procedure where, I don't do extra harm to my body or harm for the future. And this system seems really quite wonderful on being able to give people the relief that they need, if it's just, cleaning around some nerves and all that, and relocate certain things. So my doctor said I will have a good recovery.
Here I go, leaving Tampa, Bonati Center.